Hi, Mr. Jones. It appears that you have high blood pressure, which is also known as hypertension. It's defined as your blood pressure, a sustained blood pressure, greater than 130 millimeters of mercury systolic or greater than 80 diastolic. Blood pressure is the force that is exerted within your arterial walls as the blood flows through the circulatory system. Midlife hypertension, you are in your 40s. It significantly increases the risk for heart failure, coronary disease, and it even poses as a greater risk due to being African American. Primary hypertension is also referred to as essential hypertension. It usually develops gradually over many years, and it's the most common type of hypertension, actually. It's thought to result from a combination of genetic predisposition, dietary factors, lifestyle choices, and even age. There's secondary hypertension. It's a little less common, occurring in about 10% of the population with cases of hypertension. It typically has an identifiable cause. The blood pressure levels for secondary hypertension tends to be a little bit higher than that of primary hypertension. Less resistant to blood pressure medications, antihypertensives. And it usually occurs in individuals that are less than 30 years of age. It can be caused by disorders in the kidneys or in the endocrine system, or it can even be related to medications. Secondary hypertension is caused by the narrowing of the arteries that supply blood to the kidneys. It can also be caused by sleep apnea or hormone or thyroid abnormalities, or constriction of the aorta even. Primary hypertension can lead to several end organ complications, which turns into complicated hypertension. You unfortunately have multiple non-modifiable risk factors and some modifiable risk factors. The non-modifiable means that it's things that you can't change, like your family history of hypertension, mom and dad had it, that you're over 40 years old, and also being African American. Modifiable risk factors are things that you can change, and that is, well, you've already stopped smoking, which is great. The fact that you are a current drinker doesn't help. The physical inactivity, slight overweight, and you do have a high-risk job. Collectively, all of these factors can significantly increase your risk of hypertension. One thing I do want to talk to you about is your risk of a stroke, which is mostly ischemic stroke due to the complicated primary hypertension. It's the chronic elevation in the blood pressure, which will increase your plaque buildup in the arteries, which is also known as atherosclerosis. It leads to the narrowing of the arteries and reduced blood flow to the brain. Plaque can rupture in those arteries, resulting in a thrombus, and that can embolize, like kind of break off and obstruct some of your blood vessels in the brain. Stroke is the fourth leading cause of death in the United States, which makes it a pretty serious matter, and can usually be not really caught, but the risks can be decreased if we can just lower your blood pressure a little bit. So my recommendations to you, try to start being a little bit more active, manage a healthy weight, decrease your alcohol consumption, You don't need to quit cold turkey or anything. Just start decreasing it over time and follow what's called the DASH diet, which would include limiting your saturated fats, the cholesterol, and sodium. Start consuming low fat dairy products and try to limit your sweet intake too. Okay? Thank you.